All right, so last talk before the panel and the drinks, so I'll try to keep your attention, make it interesting. Again, I have nothing to disclose. So I was tasked with talking to you a little bit about workload today. And so I think we'll start it off. We'll define what workload is. We'll see what's included in it, maybe some modifications we can make to make it a little more useful. And then we'll talk a little bit about how long we should allow our pitchers to rest. We've kind of heard a little bit about that today. Maybe we should be extending the amount of time we give them in between starts. And then we'll think about some future directions, maybe for injury prevention going down the road. So a lot of years ago, workload wasn't a thing. We looked at pitch counts, we looked at innings pitched, things like that, and we didn't really total it into any one formula. But in recent years, there's been a lot of publications that have come out that have looked at workload. And so whether it's workload before or after a Tommy John surgery, workload in relation to being placed on the DL for injury, or even unaccounted workload, something we'll talk about in a little bit, workload's come up a lot in the literature recently. And most of these studies have defined workload the same. It's basically games pitched, innings pitched, and then pitch counts, okay? And the question is, well, should this be the definition of workload, or should we expand it to something else? Well, if we look at some of the studies that have looked at workload now, we can look at a study from Dr. Romeo, and they were trying to figure out if there was a risk of DL placement based on workload. So average pitch counts, cumulative pitch counts, innings pitched, things like that. And so they basically looked at DL placement for any reason, and then specifically for upper extremity reasons, over the course of 6 seasons. They had 160 pitchers that they were included. And the results of the study basically showed that the only thing that correlated with placement on the DL out of their definition of workload was total innings pitched in one of the 6 seasons. So essentially nothing correlated with placement on the DL, whether it was for all injuries or specifically for upper extremity injuries. And you can see here really nothing was significant except for the innings pitched in that one specific year. And then when you look at lower extremity, same thing. So this study really didn't find a correlation between workload and placement on the DL. If you look at Dr. Ahmad's study, he was trying to answer a specific question of if a pitcher has a Tommy John surgery and comes back to play, are they at a higher risk of revision based on their new workload? And what he alluded to before was Dr. Romeo and I did a study years back looking at guys who had a Tommy John, seeing those who had a revision Tommy John, was there a difference in pitch counts and things like that. And there was some talk about whether or not you should set an inning limit or a pitch count limit in the season back. And we found that no, you shouldn't necessarily set an inning or a pitch count limit. But what Dr. Ahmad did, he actually looked at innings pitched and games pitched in the season before and then the season after, and actually to a couple years out and before. And what he basically found was that pitchers who had a revision Tommy John, so they had a Tommy John and then went on to need a second surgery, they actually increased the number of games they pitched in the subsequent seasons by almost 15%. While those in the group that did not go on to have a revision Tommy John actually decreased the amount of games pitched by 13.6%. So pretty big difference there. And so basically what his study found was that maybe we should be individualizing workload to each pitcher, not just setting a inning limit or a pitch count limit just as a general number. Maybe we should be doing it more per pitcher. And so when we think about what those studies have shown, I kind of talked about it, really risk factor for revision Tommy John, as Dr. Ahmad showed, but maybe not risk factors being placed on the DL. But is there anything else we should include in this workload equation? And I actually think there are. So for me, I think pitch type is important, specifically in our major league players. I think fastball percentage versus breaking ball percentage is something that we should include in our workload equation. And then as Coach Burrell just alluded to, I actually think when you're throwing certain pitches is important. So if you're throwing a fastball in the first inning, it probably doesn't put as much stress on your shoulder and elbow as if you're throwing it when you're fatigued in the 6th inning. So I think it's actually important not only to think about the pitches you're throwing, but also when you're throwing them in the game and if you're fatigued when you're throwing them. Average fastball velocity. This is something we're going to look at a couple studies on, but I think average fastball velocity is something we need to put in as well as peak fastball velocity. Because if you look at this study by Pete Chalmers, he basically took all the pitchers that had a Tommy John and tried to figure out were there some predictive factors of why these guys needed to have their ligament reconstructed. And what he found was peak pitch velocity was significantly higher in the pitchers who underwent a Tommy John surgery than those who didn't. And the same thing was for average pitch velocity. So you can see the numbers there. And when you kind of look at the chart here, it's pretty striking. It's kind of a linear relationship. So as your average velocity went up, your percent chance of having a Tommy John went up. And same thing kind of happened actually for weight, which is an interesting finding. We weren't really expecting that, but kind of if you think about it, maybe you put a little more force equals mass times acceleration, right? So the mass goes up with the weight, and so your percent of having a Tommy John was higher in this group. And if you look at David Whiteside's paper, they tried to make a predictive model of pitchers who might undergo a Tommy John. And they found their model was pretty successful. About 2/3 of the time, they predicted who was going to have a Tommy John. And what they found were a couple things. A smaller repertoire of pitches, so in my mind that's saying guys who threw more fastballs, and greater mean pitch speed. And they also cited things like fewer days between consecutive games, so a shorter amount of rest time, and then greater mean pitch counts. And so I think those are some things we should include. I also think days of rest between outings is something we should include, and this is something we've alluded to. The ideal number of days really hasn't been borne out yet. People have their opinions, but as far as the literature is concerned, I can't tell you a study that says, nope, guys definitely need 6 days from between two starts. I can't tell you that doesn't exist. So should it be 4, should it be 5, 6 days? Should it be 7 days? I can't tell you what the right answer is based on the literature right now. What I can tell you based on this study back from 2012 is these authors looked to see if pitch counts and days of rest had any effect on pitchers' performance in their subsequent games. So they basically had 1,000 pitchers over 22 seasons, which totaled about 77,000 pitcher outings. They didn't look at injury rates. They were just looking at performance. And so what they found in their study, a couple of interesting things. If you look back in 1988, the max pitch counts in a game was like 169. If you look back in 2009, it was 133. So it's dropped significantly. We're taking our pitchers out sooner. If you look at the variation in between the total number of pitchers thrown in a game, the average number of pitches thrown in a game, it was all over the place back in 1988. And if you look back to 2009, we've kind of shortened that down. So we're kind of between 75 and 125 most of the time. And if you look at their earned run average, so this is how they were defining performance in their study. You look at earned run average in their subsequent start. As they threw more pitches, their earned run average started to go up. So when they looked at the amount of pitches in the previous game, or summed over the previous 5 games, or summed over the previous 10 games, you can see, based on the 3 lines here, that as they threw more pitches, their earned run average started to go up, meaning their performance started to go down. And if they actually then broke it down based on age, and what they found is that younger pitchers were actually more affected by the number of pitches they threw in their last outing. So guys who were 25 and under, there was a more significant increase in their earned run average based on their previous pitch count from the previous game. Guys who were over the age of 34, they were actually more affected by the summation of the pitches over the last 10 games. So the last game that they threw really wasn't a big deal, didn't have much correlation with how they performed in the following game, but it summed over 10 games. Their total number of pitches actually made a difference. And so you can see here that pitch counts, less days in between games, actually does have some kind of an impact on performance going forward. So maybe we need to have our days of rest specific to each pitcher. So maybe some pitchers need 4 days, some pitchers need 7 days. Maybe the younger guys need less days in between, but they need to throw fewer pitches in their previous outing. Maybe the older guys can throw more pitches in their previous outing, but need maybe an extra day or 2 of rest. That's something we need to start working towards. This is a study that's going to come out that's now in press that actually was looking at lower extremity strength and recovery. So we talk a lot about upper extremity strength, and we're starting to talk more about lower extremity strength. And this was a study in youth baseball pitchers, and they basically had these pitchers go out and they threw a game. And before they threw the game, they measured a lot of their muscle strength in the lower extremities. They threw the game, and then they measured what they were after the game. And so this was these were the guidelines that they used for when they were throwing. And you can see here that their baseline, and after the game, as you would expect, they got tired, so their muscle strength went down their lower extremities. And so then they measured their recovery of their muscle strength in every day for the next 4 days. So they measured them once a day to see when they got back to their baseline. And what they found was that the amount of days it took them to get back to their baseline strength in their lower extremities was about 2.5 days. But based on the current guidelines that we're following for Little League, they actually were allowed to go back and pitch in just under 2 days. So we're probably letting them go back a little too soon before they fully recover. So it's something to think about. Maybe we need to individualize the amount of time we keep players off based on specific things to that player. The other thing that Coach Burrow alluded to a little bit was warm-up pitches and dry humping, right? So we all hear about guys who get up, they get ready, and then they sit back down, and they don't go in. And then they get up again in the next inning, and they get ready, and they don't go back in. And we haven't really started to take that into account when we're looking at total pitches or we're looking at workload. We haven't started to factor that into our equation yet. I think it's something we do need to factor into our equation. If you look here, this was a study that was done in high school athletes. And it basically wanted to know, all right, we can easily calculate the number of pitches they throw in a game, but they also calculated their warm-up pitches, their bullpen pitches, and then pitches they threw in between innings. And so what they found was they looked at 115 starting pitchers, and when you use just the amount of pitches they throw in the game, all of the pitchers stayed under the limit, which is 105 pitches, is the upper limit of safe based on the current guidelines. So everyone followed the rules. But if you take into account all the other pitches they throw, a lot of them were exceeding this 105. Actually, they were averaging about 120 per game. 42% of them were actually going above what they were supposed to go out. Or 70% of them were going above what they were supposed to throw in one outing. And you can see here a breakdown of their game pitches versus their bullpen pitches versus their warm-up pitches. And so the live game pitches are only about 57% of what a pitcher throws in any given outing. So this is something we may need to take into account going forward when we're talking about workload. Because if pitchers are throwing all these extra pitches that we're not taking into account, we're really not analyzing the data properly if we're just taking their game pitches into account. Not to say that they throw their warm-up pitches with as much effort, maybe they don't, but maybe their mechanics are a little different on their warm-up pitches. So it's something I think we need to look at going forward. So as far as I'm concerned, future directions, I really think we need to reevaluate workload. I would put more weight on pitches later in games and look at percentage of fastballs and percentage of breaking balls and give higher weight to fastballs than I would to breaking balls in these elite level players that know how to throw fastballs and breaking balls. We can talk tomorrow about fastballs and breaking balls in kids. But for pros who know how to throw fastballs and breaking balls, I think we put more weight on the fastballs. And I think we put more weight on the fastballs later in games when they start to get fatigued and we start to see their kinematics change a little bit. As far as recovery goes, I think we probably need to personalize recovery to each player. So we need to start developing tests where we're testing their muscles. We're seeing if they're back to their baseline before we let them go back and pitch, so we can prove to them, yeah, you're back to your baseline, I can let you fly. Rather than, I think you're back, you can do a couple of tests that we run you through, and you're probably good to go. I think we need to individualize it a little better. And then one of the things I didn't talk about much because there's not much data on this, but there's some talk in some meetings about maybe serum markers of recovery. So really eliminating guesswork and seeing if there's a specific serum marker we can maybe measure, like CRP, kind of a indicator of acute inflammation of when they can get back. So if you take a measurement of their CRP before they go out and play and then take it on subsequent days to see when they get back to their baseline, maybe they've gotten their lactic acid out of their system, maybe they've recovered, maybe they're ready to go play. These are just things to think about for the future. That's all I got.